Thank you very much for having me. It was really very interesting to listen to the previous presentations, and I'm going along the same lines. Maybe focusing more on a few risks, the risk of disalignment between systems, between objectives, between your different structures. The specific risk of misinformation, disinformation, the risk related also to data scientists using the systems in the wrong way, and the objective is to improve, to reduce, inequality, and not to create new reasons for inequality. And so maybe I need to warn you that there is a part of my presentation which is not about what we can do with technology, but what we should avoid to do with technology. Our objectives are the same. I mean, every country throughout this world, when we implement social programs, we're trying to do the same thing. We have pretty much the same social assistance program. We need a mix of immediate relief, support basic needs for the population structurally exposed to economic tensions, promote social inclusion, protect human dignity, prevent social destabilization. We have more or less the same welfare programs. We work on short-term, on long-term, on childcare, on elderly care. We have subsidy programs and structures that do pretty much the same. We support some strategic fields. We support positive externalities and behaviors. We try to do the same thing, and my view is that technology hasn't changed what we're trying to do. We're trying to do the same thing. What technology can help with is more reliable, up-to-date data and simulation capacity, but not more data. Because just more data doesn't mean we're more efficient. More data means we have more work, and possibly we have less coherent data. So the objective is not to have just more data, it's to have more reliable and up-to-date data and be able to do something with it. So quickly, at the very center of this technology approach, there's always data. And however elaborate your systems are, if you don't have the data, or if the data is not reliable, there's no way you can make anything out of the technology. And if you have reliable data, then you use all these advanced technologies that we call machine learning, RPA, satellite imaging to follow what's happening in a specific area, for example. We've used that for shock, either prevention or recovery. Government as a platform to ensure that we have the same data across systems, and you have artificial intelligence impacting all these existing technologies. But the use of the right technology to have something meaningful means that ultimately you don't want just an improvement on data integration. What you want is to change what? You want to change the national registry. You want something that is more comprehensive. And we've seen from the previous presentation that we have collectively difficulties for trying to reach out to the 20%, something like that. It depends on from one country to another. That's the idea of the population that should be eligible and are not benefiting from anything. And this is everywhere. So again, it's not just having the data; it's having something that is up to date and enables us to reach this population. It's also making simulation in order to protect our capacity to deliver. We mentioned sustainability just before, but it's also simulation on who is actually eligible and should be eligible. For example, for disaster recovery, we see that we have limited capacity to simulate who are the population exposed to a risk. We all know the population structurally exposed to risk. In a nutshell, we know who the poor people are, even though we don't have all of them. But it's really difficult to say what population will be exposed to a flood or to a drought. Usually this in the national registry is difficult to keep up to date. We need to change the budget bill so that it's built in a way that enables reaching the right population and reallocation throughout the year. And we need to change the processes, our PFM processes, making sure we empower the right people, we ensure more reactivity, and we're not stuck into constraints that will reduce our efficiency. So this is what probably technology is trying to help us with. Just quick mention of research and a focus on AI for social program performance. In OECD, every country pretty much is using AI. Well, every country is using AI for its PFM processes, but the ranking of priority is interesting here. We see use of AI for more efficient allocation of resources, especially optimizing staff level so that things that were done by people, identifying vulnerable population, are not done by systems, improve decision making, improve citizen participation, typically surveys, chatbots, personalized content and service pathways for citizens so that they can find what they're entitled to receive, increase government's understanding of what the socio-economic situation of a specific population is. So all this can be improved by AI, and AI can also streamline bureaucratic tasks like filling and verifying the information that is being transferred. However, if you look at this, this is from a paper I contributed to called Governing with Artificial Intelligence from OECD, and this is the social program chapter. What you see is that policy evaluation is at the very bottom of what governments consider being improved by AI. So what this OECD research shows in this particular element is that we improve the way we work in our different ministries or agencies. We use AI and technologies to reduce workload, to get more data, to have a better understanding of our vulnerable population, and yet we don't consider at the end of the day that we need to use this technology and especially AI to improve if the policy we've implemented was impactful in the end, which doesn't really make sense. So we need to improve. It goes to show that we need to improve ex post evaluation, not just improve the way we process things today, but change our process so that the monitoring and evaluation of what we've done is improved, that we can measure our initial objective to our impact, that we can strengthen accountability. We know for every social assistance program that there are some negative externalities and sometimes corruption and theft, and so we need to improve mechanisms to track and monitor spending. We need to improve open publications and make sure that local populations can see on websites typically who benefited from what, which is efficient way to fight those negative externalities, but also that they can comment on those results and say, we're not satisfied because you forgot this chunk of population, or you supported this population that should not be eligible, for example. So policy evaluation is kind of lagging behind. Another piece of research on the use of open data, and actually a mix of open data and AI for public spending prioritization. It's a research paper by the World Bank, by David Valle-Cruz, Vanessa Fernandez-Cortez, and Mr. Gil Garcia. It dates back 2022, but I think it's quite insightful. It says that if you use public data on how expenditure is made in several countries, they propose some algorithms that, based on historical data, show you if you've reached your social program objectives or not. And what we see from this paper is that once the money is spent, basically, this is what we said before, there are not enough research made on how we measure through advanced nonlinear relationship systems if we have actually reached our objectives. And the reason is that the objectives are usually 2-3 years down the line. So our government tend to run on a year-by-year basis. I mean, we build a yearly budget, and that's what we've just seen with Brunei, and we all do that. I mean, we have to come up with a budget for next year, not for 3 years down the line. So it takes a bit of reshaping the processes to go back to what we've done 3 years ago and say, well, based on that, what decision should I make in my own budget this year, because I saw that this program didn't really work. And maybe technology, or in that case, advanced algorithms, can help us have this multi-year impact approach that we're missing. I'm speeding up because I don't have much time. A few elements of focus on some areas we're working on and that were mentioned in the previous presentation. Health. So we're trying to work on a evidence-based approach, all of us. That's something that has been mentioned in previous presentations very much. We want to help save more lives, help the work of professionals. We want to reduce inequality, not expand inequality. Okay, I got that wrong. I'll rephrase. We want to reduce inequality, obviously. And so we need a roadmap, basically, of how on health, for example, if we look specifically on health, we can scale up technology. So if we focus on AI, I'm referring to an OECD paper. How can we use technology to reach those objectives? We need to establish a strategy at the intersection of AI and health, an oversight body for the use of AI in health, because we see that there are huge risks. We're going back to that afterwards. We need maybe a national regulatory sandbox. The EU has just implemented one. There's an AI Act that enables us to work with the data and see what we can get of it at the EU level, at the European Union level. We need a national approach to those technologies, and we need to implement probably new approach to procurement. So we need new procurement guidelines. We need to change the way we assess what the health workforce is doing, and to probably change the national legislation. So my point here is, if we really want to use technology to improve social program delivery, it's not just technology, it's a mix of technology and legal and organizational change that have to be made all together, maybe not all at once, but all together in order to actually scale up. Otherwise, we're just playing with number. We're not actually changing the way government works. So there's a difference between having a change at the IT or digital team level and having a change at the government level. We talk a lot about adaptive social protection. So adaptive means that we had a plan, but we're adapting because the reality is not exactly what we had planned. The reality is different because we didn't really know what the population's needs were, for example, or because we have an external shock, like a disaster, and we need to adapt. In order to do that, we need an improved cooperation between all the actors and social protection stakeholders. We need to better identify what is chronic. We're moving away from what we could say is a conjunctural risk to what is a chronic need. For example, drought or flooding in some regions are unfortunately not unpredictable, but just chronic. So we can't say we have a hurricane in the region and there was no way we could predict, because we know it will happen. I just made an intervention in a country that predicts over the coming years at least one hurricane per year. So it's not conjunctural anymore. It's still a disaster, but it has to be included in the budget process differently, more as a chronic need, and provide more simulation, more intervention. So here, the idea is to focus on what business users, what I call business end users, so that's our public officers needs. And what they need is to have more data, more dashboards, more simulation, coming from many different systems, from many different sources. And we need to have alignment between the concepts. That's probably the key takeaway of my presentation here. So it's one thing to remember, is this. Between all the different projects, program, implementation structures and systems. They don't share the same concepts. I mean, at least in the countries I've seen. For example, vulnerable. What do you mean by vulnerable? You don't mean the same thing if it is like structurally vulnerable economically, poor people, or if it's vulnerable to a shock. You live near a river, this river might get a flood, or you're vulnerable because you have no health coverage, so you're in perfectly good health today, but you're still vulnerable because something goes wrong tomorrow, you're vulnerable. If you look across the different systems that you run, like budget systems, treasury systems, expenditure, national treasury, if you look at the different structures from at the national level with the international partners, if you look at the different programs that you run, and you run many, many programs, I just listed a few here, but we've just seen with the different countries that you have many more, the concepts are not the same. So it's really difficult in the end to have this simulation and dashboards when you're not using the same concepts. So technologies can help you connect the dots and have, typically we could say data lake, things like that, and have something that is meaningful. But you still need to work a lot on what do you mean by, for example, vulnerable. I'm going fast because I'm actually I've passed my due time, but this is complicated. Having this shared language means we process large volumes of data, and every day we process larger and larger volumes of data. And we have data scientists that want even more, and we have unstructured data now that we can deal with. And the key thing is, how can I use all this data to identify complex patterns, weak signals, early signs of emerging changes, threats, opportunities? How can I use this data? And it takes a lot of technologies that are for some new, and I'm not going through that. But the key thing is your social assistant information systems is part of a bigger thing, which is all public service digital systems. And you can't have a good simulation system and a good predictive system if you don't connect this with all different sources from outside, which is obviously, which will, or is, if you're doing it, obviously painful because it takes a lot of technology. So obstacles and risk, we don't want technologies to decide on who's benefiting from what. That's the last thing we want. And we've already seen some very, very negative externalities from using technologies in social protection, in social assistance. Two quick examples. One comes from this report I mentioned, which is a European AI fund on how AI has driven welfare system to deepen inequality and poverty and not reduce it in certain countries. One of these countries mentioned in this report, you might say that this report was politically biased because it comes from Amnesty International, but I think it's interesting to read it. I mean, one studies the case for France. So I'm talking about my own country. I'm allowed to do that. What it said is that some data scientists in the social assistance program in France decided to work on what they were supposed to do, identify risk patterns. That's what a data scientist does. I mean, we're asking those guys to do that. And what they identify is that they say, oh, we have more risk of fraud if you have no degrees. Let's focus our controls on people with no degrees. And we have more risk of fraud with people who are immigrants. Do we really want to go there? I mean, is it like what we want from technology? And the results of these algorithms was a very strong political reaction within the country that it should not be used that way. And I personally think rightly so. So we must make sure that the impact of technology is assessed. And to be clear, we see a race for big data, AI usage that sometimes has not been thoroughly studied in terms of how the data can be biased or badly used, for example, for misinformation. Another example was Australia RoboDebt that claimed back 470,000 incorrect debt notice to households that had no debt at all. So again, not something we want, not efficient, and doesn't give I mean, ethically questionable. So yes, technology can help us improve. This is my last slide. But we need to remember that we have a huge HR challenge to find the right profiles. But the key profile here is to be able to manage the complexity and risk of what we're trying to reach in terms of social impact, not just managing the data, but foreseeing in 3 years' time what we're trying to reach. The data challenge, because it's scattered all over the place, and we see that DBrain, for example, in Korea is managing 63 different sources of data, so that's going to go, and it's not getting any better. And the ethical challenge, obviously, that we tend to forget because we're trying to go too fast in some cases. That's it for me. I'm open to questions.